And welcome back. I am Darren Hyme. The federal shutdown is continuing to have a ripple effect across the nation. In our area, nearly 1.8 million New York City residents could lose access to food assistance this week, including nearly 300,000 in the Bronx's 15th congressional district. The United States Department of Agriculture says it will not use any of its $6 billion contingency fund to cover food stamp benefits in November. Governor Kathy Hochul, she announced $40 million in emergency state funds, supporting an estimating 16 million meals statewide to help our fellow New Yorkers in need. The question is, how does this all play out? We're pleased to be joined by Anne-Marie Scalia, the Child Services Organization at the Jewish Child Care Association. Thank you so much for joining us.
Thank you so much for having me.
And really tough times.
It definitely is.
A lot of people really are grappling and wrestling and dealing. From your perspective, I know, congratulations, I know new boots on the ground here too, but you're almost being thrown into the fire.
Yeah.
We haven't seen this before.
So thank you for, first of all, for dealing with and having this on your show, because this is really an important issue. So this is my second week at JCCA, and I just want to talk a little bit about JCCA first and tell you where I come from with this topic. JCCA is a 200-plus-year-old agency that provides services for children and families. We've been around for, like I said, over 200 years, and we started out as an orphanage and have progressed to 37 programs that we now have to help families in need and the children that they are caring for. So we have a myriad of services, and we meet people at different points of their lives, whether it's crisis or regarding mental health issues or behavioral issues with children, and we have foster care children also. So that is what we at JCCA do, and so we see the families who are impacted by this shutdown, who are impacted by the November looming deadline. We are already hearing from our families about the amount of confusion that they are dealing with, both regarding the shutdown and the November benefits not being available, and the changes that are coming to SNAP, that happened with the big, terrible bill.
Right.
But from my vantage point, being 2 weeks into my current role as CEO of JCCA, my background also is that I work for the city, and I was the general counsel at the Department of Social Services. And from that vantage point, I was working very closely with the SNAP program and the social services programs that people rely on so much.
Right.
So I actually know how the program runs. I know how it is administered, and I know the inner workings of how the mechanics work. And so when you asked me, we have not been here before. We haven't, because the last time we had this shutdown, we at the agency, the state, was able to forward 2 months worth of benefits so that we would not be in this position. That ability to do that was taken away by the federal government in the last couple of months, in the last rounds of changes in the regulations. So the options we had in the first go-around were stripped away. And so now we are not left, we don't have any options, and this November date is a real thing.
Right.
Yeah.
And you have so many families right now who are living in poverty, right at the line, just above it, and children. We're talking about the welfare of children. And when you take the two of those and you link those together, poverty, child welfare, these two are pretty prevalent factors that we should be considering during a time such as this. Talk to me a little bit about that correlation.
Yeah, thank you. That's a great question. So, it's hard for people to understand. And what I try to do is, because I've been in this world for a long time, right? I've represented children who were abused and neglected in family court. So I understand that there are stressors that bring people to certain points of their lives, right? The clients that we're serving, the children and their families, they're already coming to us with other stressors. Being secure in your ability to put food on the table is one stressor that no one should have to deal with, no matter what socioeconomic class you come from, right? That's why we built the safety net. This is the very purpose for which it exists. There is a huge eligibility requirement. the families that actually go out and seek this benefit, they have to jump through a lot of hoops.
Mhm.
They've done that. To their credit, they've done that and they've gotten the service that they need to keep their families safe. And there are continuing requirements that the city and the state and the federal government puts upon people who receive these services that are onerous. So if you think about it, the families who are receiving these services are making a concerted effort to make sure that their family are stable. They're doing everything they're supposed to do to make sure that they are eligible and that they maintain that eligibility. And so they've done what they needed to do. You strip that away, and you are putting a crack in the foundation of what families are dealing with, right? If you think about it like a house, every house has a foundation. The head of the household is that foundation for children. When you begin to pull away that foundation, the whole house crumbles. So we see this is not rocket science, right? When you take away something um, so baseline from a family, where a family now has to worry about, where am I going to cut, right? Am I going to not pay the rent? Am I going to not go to the pharmacy to pick up that medication that my child so desperately needs? That is a huge stressor as a parent, as a caregiver of children, right? We've
Right.
all, for people who have children, we know what we have to deal with. But then you think of people who are just making ends meet, who are working 2 or 3 jobs just to maintain a level of being able to live in these high price environment that we live in. You take that safety net away, and now you're shifting your worry. You can no longer worry about getting to your medical appointments, getting to your mental health appointments, making sure that your children, all their services are being attended to. And children know when the household is under stress. They
Right.
know it. And so there is a complete ripple effect that happens as a result of this safety net being pulled out from people. Not to mention the economic impact on the communities where this money is being spent.
Yeah. Let me talk about the governor for a minute because she's definitely said, I understand, I see the needs. 40 million immediately deployed to help families in
Yeah.
need. But you're hearing people from the boots on the ground say, listen, I appreciate the 40 million, but the reality is that's not enough. Um, your take.
That is truth. That is absolute truth. $40 million in this environment is a drop in the bucket. What that does is maintain the food programs that currently exist, maintain the school lunches, and I was seeing this morning where schools are doing GoFundMe drives to make sure that there's enough food in the school for kids to take home. It will keep the food banks open, but think about it, right? Like, you're used to going to the store, like you and I, we go to the store, we buy our food, and that is a convenience. To have to go stand on a food line in order to get a box of groceries, think about the ripple effect that has. If I have a job, and just so we're clear, there's a lot of misnomer about who is on SNAP,
Right,
right? Working
right.
people need SNAP assistance. It's a fact, because the wages that we're paying to families and workers is not enough to, especially in New York City. So it is. I applaud the governor. It is a step in the right direction, but it's not going to be enough if this shutdown continues on.
Yeah. So let's talk about the federal government. What's the message to the federal government? What would you say, given your position and your perspective?
Yeah, I come to this as the CEO of JCCA. And I want the federal government to understand that there are people behind all of this. There are actual stories. There are children in college who will not be able to go to the store and get food so that they can study for their exams. This is not that we cannot use the folks who rely on this program as the political football. It's just not morally or ethically right. There are other things that can be done, but this is not the program to mess with at this point,
Right.
because it will have a ripple effect. I mean, I- it's hard for, I'm very passionate about this issue, so it's really hard for me to
Agreed.
stay
Yeah.
calm about it,
Right.
because if you think of, you send your child off to school, how does a child think in school when they know they're not sure where their next meal is going to come from? As a society, we have determined that it is in all of our best interest to make sure everyone in our community is fed. Why? because when you're fed, you can be a productive member of society. You can remove that barrier. That's one less barrier that our citizens have to deal with. And if we don't, and we go down this path, that impacts us as a community from every level,
Mhm. You talk about children. I'm saying when you think about children from this perspective, when they come to school sometimes, that's the only real meal that they get.
That's right.
And that's why it's so hard for them sometimes to even concentrate in school because at home, they're already going through a food desert.
Yeah.
So to have this be put upon children, families, this just cripples a lot of millions of people who innocently are being affected as a part of this. And I hate to say, with what's going on at 1600 Pennsylvania Avenue and right here, New York is not looked upon favorably. So that becomes even more compounded.
I absolutely agree. And, I want to say something else. It's not, when you don't have enough money to buy food, you have to make choices about the type of food that you buy, right?
Right.
So when you're left with, I either can buy this sub-level food or nothing, think about what we're now telling families to put into their children's mouths, right? Like that dollar's now got to stretch a longer way. So think about the health, like not only the educational implications, but the health implications that we're now putting our families into. That's going to have a ripple effect on them. If you, even if you just think about it from a fiscal point of view, you're literally going to cause people to have health problems as a result of this. So,
Mhm.
I try to appeal to everybody's sense of sensibility, right? Because if we don't do these things, you're costing the community, you're costing the federal government more money down the line.
Right.
There is a benefit to doing this. And, I've been working with children my entire career. JCCA works with families who are in crisis day in and day out. Our fear is that that crisis point will now elevate to a different level. We work to reduce the crisis. This impacts and makes that crisis even more acute. So we're going to have to really try to understand better how to support and help. And it takes a village, and we're just one part of this puzzle. But it is really upsetting when you see what's going on at 1600.
Yeah, Anne Marie Scalia, I gotta leave it there, but I do, I wish I had time because I want to ask you one more thing, and just answer me real shortly.
Sure.
Conversation about empathy, right? Because I know you're dealing, I know people are dealing, but that message going across the staff and those who are working in this time, empathy.
It's hard. Our staff are taking on the crisis that the clients are imposing on them, and we're all trying to lift each other up. But if we're not empathetic as a society, we've got nothing.
Yeah,
And that is a destruction of society from
yeah.
up to down. So thank you.
You gotta come back again.
Oh, absolutely.
All right,
Thank
Anne Marie
you.
Scalia, congratulations and welcome again.
Thank you.
Yes, and so listen, if you want more information on finding food aid in New York City, please go to finder.nyc.gov/food help. There you can get that. Also, if you want more information on the Jewish Children's Care Association, please go to jccny.org. Encouraging you, don't go anywhere. We'll be back with more Open coming up right after this.